The big question, what makes some children more vulnerable to becoming autistic and not others? And that's what we're going to do in this section. And until we find out, we don't know what we don't know. It's not just bad luck. Identifying risk factors is the only way this epidemic can be stemmed. And I actually do believe that with the right coordination with this information between the research and researchers and public health policy, that it would be possible to turn the tide. Looking at the risk factors, there are so many studies about this in the research, and I don't understand how it hasn't seeped out, this information. And I think I'm so pleased that this group is here, and so I know that I'm not the only one who knows this stuff now, because it feels like it. And it would be good for this to become common knowledge so that we can do something with it. Okay, so most autistic children have mineral deficiencies. It's a reality. The trace elements are used by the researchers to help diagnose, prevent and treat autism. And this study is about the trace elements and how severe are the imbalances compared to how severe the autistic symptoms are. Testing tells us what vitamins and minerals a child needs, and it allows us to monitor their response to these interventions. Most ASD kids are never tested for nutrients or oxidative stress, the vast majority. If parents want this to be done for their children, they need to see a natural therapist or an integrative doctor. If they see an integrative doctor, they can get most of it on Medicare, and natural therapist, it's user pays. A meta-analysis comes up several times in this presentation. So a meta-analysis is when they've reviewed hundreds of studies, checked them all for quality, and then combine the results of these multiple studies. And then they come up with a result. So where I have been able to, I've found meta-analyses. So it's not just this one study saying these things, it's hundreds and hundreds and a scientific agreement that this is the case for this particular study. The systematic review gathers the relevant evidence on the topic with good quality studies, and then the meta-analysis crunches the numbers and comes up with the result. So when you see a meta-analysis, you know that this is very solid, reliable data that is being recorded. Here we're going to take a look at zinc, which is one of the most common deficiencies found in general populations and certainly in autistic children. And the meta-analysis that I just mentioned here shows that autistic children have higher mercury and lead levels than controls, non-autistic children. And one of the reasons for this is because zinc is essential in helping to mop up heavy metals and other toxins. And so when their base levels are too low, they are unable to do this. And of course, those heavy metals affect neurodevelopment. Also with zinc, it is a key regulator of gastrointestinal development, so it's very important for a healthy gut and a healthy microbiota. And a lot of autistic children have deficient gut function, and that contributes to their neurodevelopment. And you would have to say that pregnant women need really good levels of zinc for their child to have adequate levels. And a zinc supplement is something that can be taken quite safely without any negative effects whatsoever. Here's a test where we have high lead There's the lead there. When you can see that, we know exactly what to do from a treatment point of view. Okay, so the cadmium's a little bit high, but this is a real standout. And you look at the zinc, and actually the zinc there is in the positive. So this midline here is the neutral point. All the green bars are within normal range, and the yellow bars are either a bit high or a bit low. And here we've got the zinc in the positive, but we know from experience if we give this child big doses of zinc, it will actually turn up down here after a while and then slowly increase. A vitamin D deficiency is very common in autistic children. It's crucial for normal brain development, neurotransmission and immune function. And this study had 96 references, and it's pretty clear that autistic children have lower levels of vitamin D than non-autistic children. In the first trimester, if the levels are low, it's more likely to be an autistic child. And here are some vitamin D deficiencies. This is a 4-year-old boy, vitamin D deficient. And then 14 and 17-year-old girls. Now these girls, within 10 years, could be having babies. Then you've got the vitamins B6, B9 and B12. They seem to work together. And deficiencies of all three of these vitamins are recorded in a significant number of autistic children. So we know that folate is very good anyway to help prevent birth defects. Folate is important in the development and synthesis of DNA and RNA, your building blocks, and also it helps make sure that the red blood cells are properly formed. So if there is a B9 deficiency, it compromises the neural development. Now everyone heard of the MTHFR gene? Okay, so it's MTHFR is a genetic deficiency that it means that some people can't process folic acid or vitamin B9 in their bodies. And they must be able to have a supplement so that their baby is born normally. It's a methylation deficiency, so it means that it also means that their capacity to eliminate toxic material from their bodies is compromised. So we call them undermethylators. So the B9 deficiency is a very important one to correct. Now, it also happens that with vitamin B9, you can actually have too much. So what happens is pregnant women are given vitamin B9, which is great, or folic acid, but it's one of those things that needs to be monitored because the researchers also came up with if you've got naturally high levels of vitamin B9 and then you're given a folic acid supplement, then that can actually create autism. So this is something that I had to decide whether I was going to present this piece of information, but to me, what it means is that we actually need to monitor levels. We can't just give people stuff and never check them. And vitamin B9 in pregnancy is one that should be monitored. So if a pregnant woman is having her blood test and she's got a really good, healthy or high level of B9, she may not actually need it. But why not check her in 6 weeks or a couple of months and do it again and see if it's low? But all women who have this MTHFR gene, I think if you're going to have a baby or if you're pregnant, you find out if you've got that gene and get the folic acid in as soon as possible. And doctors understand this very well. So here it is. B6, B9, B12 and D, low, low, low. So we know when we see a result like this, we don't know if this is all of what a child needs, but there are times when you can give vitamin D and see quite a big difference. I don't know if supplementing vitamin with the B vitamins that you actually see the difference in the child, but certainly this kid needs more. Low thyroid function, another meta-analysis. Low maternal thyroid function is associated with low verbal IQ in offspring. So iodine, this implies iodine, of course, for normal thyroid function. So lower thyroxine blood levels is associated with a greater risk of autistic traits. Iodine is the second most common nutritional deficiency globally. Does anyone know what the most common one is? Is iron. Yeah. And so that's important too, but everyone knows about that. That's not an issue because women are checked for their iron levels and they're made sure that they're normal. So Dr. Krez Eastman is this wonderful Australian professor who went into Southeast Asia and Nepal and found all these children suffering from cretinism, from insufficient iodine, and saw to it that they all received iodized salt, and really he's known as the man who saved 1 million brains. And he works as a consultant to Westmead Hospital to this day. And he came back, this is probably a good 10 years or more ago now, came back to Australia and tested the iodine levels of school children in Tasmania, Victoria and South Australia, and found that 50% of them were deficient or borderline, right? This is not vitamin D where you can control it with sun. Here's the iodine level of a 15-year-old boy. I just selected that at random. I don't know if he had a learning disorder or not, but it's hard to imagine him being able to concentrate very well with that low level of iodine. So iodine testing is done via a urine sample. So if you're a pregnant woman, you're probably never, ever going to have it tested. It might be in your supplement, your pregnancy supplement. But if it's not tested, you can't make sure, So a high seaweed diet, that kind of thing, is a really good idea for these kids. And this is Cooper, whose mum was one of the ones that leant over the desk and said, "You have to tell everybody about this," because her son, she's a school teacher, and he had all these alphabet diagnoses, and because she's a school teacher, she's very active in helping him. And here's his zinc level, low, vitamin B9 low. Here's the classic learning disorder profile, low vitamin D. And there's his iodine, which isn't in the red, but it's still low. And in the case taking, this is a patient of John's, in the case taking, obviously it was deemed that the iodine was the key in this case. And he took iodine, and literally his mum emailed John the next day and said, "Oh my goodness, his brain's just switched on. Doesn't need a teacher's aide anymore." So once upon a time, no medications were considered safe to be given during pregnancy. Does anyone remember that? Oh, yeah. The first group of medications to look at that are given commonly during pregnancy are the serotonin reuptake inhibitors, or antidepressants, and these are designed to improve mood. However, there has been an enormous amount of research on the impact of these medications on unborn children. There is so much research about they increase the incidence of autism. In this, it says it increases the incident risk by nearly 90%. I wouldn't take that at exactly that amount, but here's the 3 meta-analyses that I found on prenatal SSRIs and ASD risk, and they're also talking about taking the SSRIs before conception. The emphasis is on the mental health of the mother, because that's a factor also. If the mother is under a lot of stress and her mental health is poor, then how well is she going to be able to look after the baby? So the motivation is good. And so what do? Dr. Kelly Brogan, a few years ago, she's an American woman who's a psychiatrist, wrote this book called A Mind of Your Own. And it's designed for the public. It's a great read. It's in plain speak. And she says she rarely prescribes antidepressants. So now, antibiotics. Systematic review, again, and meta-analysis. Early antibiotic exposure, including pre- and postnatal, significantly increases the risk of ASD in children. It doesn't get much clearer than that. So that's a 2019 study. And then you have the advent of GPs prescribing to patients at up to 9 times higher than the recommended guidelines. So once upon a time, antibiotics were preserved for life-threatening illnesses. Now there's a lot of just-in-case prescriptions. And homeopathy is such a suitable modality to address the infections and the acute infections. We were talking before about acute prescribing. There's a lot of potential here for homeopaths and homeopathy to address the issues of pregnant women who need something to treat them for whatever infection they may have. It can be, respiratory infection. And there are a lot of other measures too. There's even herbal medicine would be safer. And ear infections are the most common reason why children are prescribed antibiotics. And we have lots of studies in homeopathy of the benefit of treating ear infections with homeopathy. So in order to get a benefit for one child with an ear infection giving an antibiotics, you have to treat 20. Watch and wait is the best policy, the most recommended even medical policy. And there's a study here by Iris Bell, wonderful homeopathic researcher. Evidence favours the pragmatic use of homeopathy in children with acute, uncomplicated upper respiratory infections or otitis media. So if we're homeopaths and we're going to do this, we need to hold parents' hands. So some of you know that we used to run an ear clinic. And so we got a lot of practice in saying to parents, well, see if you can manage without antibiotics this time. And once they've done it, they can have more confidence. So what tends to happen is the child will get the antibiotics, and then the next morning they wake up bright as button. But actually it takes 48 hours or longer for the antibiotics to kick in. So if they don't take the antibiotics, there's a good chance they would have woken up bright and cheery the next morning. So, and so if you can get the parents to see that, they get really excited by it. And I'll say to them, it'll shorten the period of the illness because of the body temperature, the heat of, that's a fever, is another issue, is going to help quell the problem. So we have to be by the parent's side when they're first using homeopathic medicines and help the parents ride it out without the antibiotics. Okay, anyone heard of valproic acid or valproate? That was a new one for me. So this is prescribed for epilepsy and bipolar disorder and migraine. And it's being prescribed for pregnant women, even though there's a warning about birth defects in the paper, in the packet. And the justification is that the mother's mental health is more important so they can care for their child. And then that begs the question is, how are you going to care for your child if they are affected by that drug? Paracetamol. In America, in Australia, it's also known as Panadol, and the equivalent in America is acetaminophen. Same thing. So, this drug has never been tested for safety in children, and that was in a systematic review. The effects of paracetamol is that it triggers oxidative stress, and you now know that oxidative stress is a state of inflammation. And the long-term effects of paracetamol on neurodevelopment have never been evaluated in humans, so that's adults as well. It inhibits prostaglandin synthesis, which is essential for neurological function. And the numbers of papers that are coming out on this topic is enormous. And there's also a notion that the elimination of fevers may be responsible in part for the induction of autism. Certainly suppressing a fever is not recommended, as you'll see a little bit later. So why is paracetamol a problem? What does it do? So there's this substance called glutathione, which is our big detoxifier in our bodies. And it has three key functions. Breaks down nutrients, regulates immune response, and protects against oxidative stress. Right? So if a body is dealing with a certain amount of toxins and then they have paracetamol, that is really going to compound the problem. Okay, reduced glutathione levels in ASD kids. 2 meta-analyses and a review. So the less glutathione you have in your body, the more oxidative stress. And you need glutathione to combat oxidative stress. Glutathione metabolism biomarkers can inform the early diagnosis of ASD if you're looking for it. And the last study, the glutathione imbalance is a leading factor in ASD. And it would appear that giving paracetamol is kind of like the fastest way to reduce your glutathione levels. Now, I included this study because I actually came across it quite a few years ago in relation to the allergies epidemic. And you probably know that a lot of autistic kids have got a lot of allergies as well. And even if you're not autistic, a lot of kids have got allergies as well. So this is nearly 250,000 children in 31 countries of 6 to 7 years. And when paracetamol is used in the first year of life, it increases the risk of asthma by the time they're 6 or 7 years old. And even if your child has paracetamol once a month, it can still treble the incidence of asthma in 6 to 7-year-olds. And this helps to explain the huge increase in childhood allergies. And prenatal exposure to paracetamol and ADHD, autism risk, systemic review and meta-analysis. So the evidence of neurodisrupting properties is accumulating. This is a 2018 study. So we're talking about 132,000 mother-child pairs, and with a long follow-up period from 3 to 11 years. And the result was that paracetamol use during pregnancy is associated with an increased risk, not just for ASD, but also ADHD and hyperactivity symptoms. So most kids get paracetamol from an early time in life for respiratory infections, tonsillitis. This is the bit I find really alarming. So Will Parker, the researcher for this, had to become an independent researcher so he could continue his work. He's saying hundreds of studies on the epidemiology of autism show that ASD could be a paracetamol-induced brain injury in newborns and young children. $195 references on that study. This is the paracetamol post-vaccine dosage that I randomly plucked off the internet. This is at an English hospital. So at a baby up to 6 months old, usually at 2 and 4 months. So this is irrespective of the baby's weight and irrespective if the baby is premature. So if a baby is born 6 weeks premature and they're getting their 8-week vaccine, they'll get it on time, but actually in developmental terms, they're 2 weeks old. Okay, so then you've got 3 doses of paracetamol within 8 to 12 hours of having your vaccine. Now, I don't know if it's actually mandatory across the board, but this is a protocol here. And if the child develops a fever, the parents are advised to give them paracetamol. The medical community and parents are educated to do this. And now the law cases and lawsuits are coming in America. I haven't heard anything about that. Has anyone else? And then some innovative researchers have started combining the toxins with the paracetamol, paracetamol, antibiotics, and glyphosate combined effects. Of course, this is what's happening in children's bodies. Studies on single substances don't really represent the real world. And our kids are dealing with a chemical stew, aren't they? And it is broad thinking of the researchers to do this. And they're talking about autism as being an epigenetic epidemic. So epigenetic, we're all born with the genes we're born with, but epigenetic is how those genes are expressed. And mostly those genes that cause problems are dormant for a person's life. But if they get enough stimulation and enough triggers, they start to express themselves. So epigenetic really means the expression of genes in response to environmental triggers. And as one researcher says, the genes load the gun and the environment pulls the trigger. Then we've got another study of paracetamol and the PFAS. Both affect liver function. They affect the gut-brain axis, inhibit detoxification pathways, and contribute to neurological diseases. When I see things like that, I wonder how every child isn't autistic. So the ones that aren't are doing pretty well. Some say paracetamol is the key to the autism epidemic because of how it hobbles the detoxification pathways. So if you say to a parent, sorry, you can't use paracetamol, can you imagine? It's become a panacea. And I had a mum say to me, I don't know what was wrong with him. I just gave him some Panadol to settle him down. And that's pretty normal from what I can tell. And no, and in your handbag at all times. And why wouldn't you? You know, if you want to look after your child, you want your child to be comfortable, and no one is educated otherwise. So the universe has come to rely on paracetamol for fever and pain for children, and adults, I think, can tolerate it a lot better. We know how to look after our livers if we don't take, above the recommended dose. Fevers and pain respond so well to homeopathic medicines. It's so exciting to treat children in this area. And homeopathy really is a viable alternative for this problem. And I have an ear pain story. When we were running the ear clinic it was in the Balmain clinic, and this screaming from the waiting room, this child, little boy, still in his mother's arms, so maybe a year or so old, and he was one of those children that had the very resonant cry. And so we could not literally conduct the consultation. So he came in screaming with ear pain and got out the chamomilla, which is a common ear pain remedy, and just drip fed it to him. And at the end of that 30-minute consultation, he was snoring. Yeah. So you see things like that, and it really galvanizes your belief. It's like, if I'm going to help parents not use paracetamol, I can do this. Okay. So now some things from the Royal Children's Hospital in Melbourne. They say that the severity of illness cannot be predicted by the degree of fever. And a fever is not dangerous. It's a sign the body's immune system is working. Such an important message. And you look to see how unwell the child is. So the child might even not have a fever and they might look terrible. That's when to be concerned. And I have had one child. This woman had 4 sons, and they were all in the clinic, little room in Mittagong. And her eldest son had a 40-degree fever. His face was bright red, and he was running around. And she said, oh, he's always like that, gets fevers, no problem. She was a very experienced and unfazable mother. And there it was, So just because the number is high, it doesn't mean the child is ill, because the child could have a fever of 38 and be much more concerningly unwell. And this is also from the Royal Melbourne Hospital. They've recorded parents' experience of fevers. So, number one, lots of kids have lots of fevers. 30% of them will take their child with a fever to a GP or A&E. And a third think that it's serious. And 40% believe an untreated fever will cause death. So there is a lot of fear in the community. And parents misunderstand, this is all from the Melbourne Hospital, this is not my opinion, but they misunderstand the role of medication. 4 in 5 believe it's important to lower the body temperature of a child with a fever. And actually, the material I have found from Melbourne Hospital is the paediatricians are saying, yes, let the fever run. It's good to let the fever run. Nevertheless, to imply that you shouldn't use paracetamol to any family, I think it'd be pretty confronting. So there's ibuprofen. Now, I got a little bit excited about this because I was thinking, oh, it's an anti-inflammatory. But actually there's a study here. There's very little research available on it, but this study talks about this medication. The study that is done is that it is associated with intellectual disability, not necessarily ASD, when used during pregnancy. Then I got excited about aspirin because that's what we had. I remember my mum giving me an aspirin and raspberry jam, and I loved it. Mm. And that is what preceded paracetamol. And it's also a potent anti-inflammatory mediator. So then I got a bit more excited. But there is a disease called Ray's syndrome, which does cause mental disability, which is associated with giving children aspirin. So there isn't any really safe, viable alternative that I'm aware of, apart from homeopathic medicines or other natural therapies. If we're going to ask parents to use something else other than paracetamol, then we're going to have to give them some information. This is what we've done in our clinic. Treat your child yourself. It's 100 common childhood complaints, and it's also got nutrition, practical measures, that kind of thing, and as well as the homeopathic medicines. And then the little ear infection book it's a little in your palm for parents to refer to, and it really has got all of our experience from the several years of the ear clinic in there. So it's an unassuming little book, but it's got quite a lot of helpful material in it for parents. And parents want to. If you ask a parent, would you like a good alternative to antibiotics or, paracetamol, they'll always say yes, but they have to know it's going to work, and they have to know how to use it. They have to have confidence in it. So they want to use natural therapies if they know they're going to be effective. And all parents need after-hours resources, so a book is good. I personally wouldn't go online if my kid was screaming. I'd be looking at a book. And, you can supply them with medicines and instructions, and it builds their confidence. You don't see the parents for so many appointments when you walk them through a few crises, and they love the independence, and then they tell everyone else. And it also helps to reduce the fear. So, summary of risk factors. So this doesn't actually have paracetamol on it, but I really liked this graph. It was the only graph like this that I saw in regards to risk factors. So up here, down here, is the protective factors. So the most protective thing is the folic acid. Then there's breastfeeding, omega fatty acids, diets rich in fatty acids. There's your vitamin D, there's your iron, and melatonin. So melatonin would be a supplement. So then you go up here, this is the risk factors. So these are the factors that are the most likely to mean that there would be autism appearing in the offspring. So to have an autistic sibling, maternal use of anti-epileptic and antidepressants, so that's your SSRIs and your valproate. Interesting, there's the delivery complications. So stress is a factor because the cortisol affects the biochemistry. Obesity, diabetes, air pollution is here. Maternal autoimmune diseases, advanced maternal age, IVF, prenatal infections, we'll look at that a bit later, and cesarean section. So if you look at this top here, the biggest risks are the anti-epileptics, antidepressants, already having an autistic sibling, and folic acid. Just that message alone, and we'd have to throw paracetamol in there too, but this paper didn't include it. The perfect storm. A cascade of risk factors. So, you conceive and you're taking, a woman is taking antidepressants. Not an uncommon, unexpected scenario, I wouldn't think. She may be one of the 50% of Australians who are deficient in vitamin D. She's probably never had her iodine measured or tested. She's probably low in zinc because we see on a regular basis the level of zinc deficiency in our population, and it's not necessarily because of low intake, but the demands on the body from grappling with toxic exposures is challenging the zinc. So I would say without hesitation that everyone on the earth needs a zinc supplement. And folate, well, that needs to be tested, but she could be one of the MTHFR people and really need a folate supplement. So toxic exposures increase requirements. She's almost certainly drinking fluoridated water, impacting the thyroid iodine levels and thyroid function and vitamin D. I've mentioned that already. So she got a fever, or she got a flu, or some pelvic pain, took some paracetamol. She might have injured herself. Then she had the flu vaccine. So that, because of the viral fragments in the flu vaccine, that would count as an exposure to a microbe. Then she's one of the 1 in 4, 25% of the population who gets strep B infection, and she gets antibiotics for that. Then she might have a caesarean, and then she'll get prophylactic antibiotics for that. And then if her child is anything like a vast number of other children, they're going to have a course of antibiotics and a bit of Panadol in their first year of life. Pretty normal scenario, like a fire waiting to be lit. And that's without factoring in the chemicals and the pesticides and herbicides.
And after the break, we're asking the question, do parents wait and see if their child develops autism, and what some of the things they may be able to do in order to reduce that possibility?